During this conference, we had quite a few exciting topics. One of the topics that I presented was the use of 3D technology in plastic surgery. Nowadays, things are going further to 4D, 3D, and this is what we would like to present to the surgeons. Number one, the use of the 3D technology. How to utilize this technology in enhancing your results during surgery, and how to use this technology to improve the patient's understanding of the procedure. And number three, how to use this technology to plan your surgery. All of these can be grouped under the term of the use of 3D technology. The 4D technology is when you add the element of time into this. When you add the time, what will happen to a procedure when I do today? What will happen to that shape or that appearance after 1 year, 2 years, 3 years? This is something that is now developing and in the stage of enhancement, and will probably be in clinical trials in the future. But at this time now, what we use is 3D imaging, 3D printing, and 3D virtual reality. These are some of the cases that we use it for. Facial surgery, like nose operations. How does the nose look like after the surgery? How do you plan the surgery? How much do you need to take out? How much do you need to improve on? Because plastic surgeons are not only doctors, they are also artists, and they're also engineers. Everything works with a precise measurement, and this is why we need this technology to improve the results of the operations. So this is one of the things that we've discussed during the procedure, during the conference. The second thing is the use of other technologies like ultrasound, radiofrequency, nano laser, pico laser, which is even more precise and more accurate than the regular laser. Why pico? Because pico, other lasers target areas. They measure it in millimeters. But the pico measures a number of cells, the tiniest amount, which is good for things that are very precise, things that need careful excision, careful planning, and careful execution. The future of plastic surgery now is going further and further into areas that were not discussed in the past. Number one, before plastic surgery, people were thinking that these are for patients who are older, patients who exceeded a certain age. Nowadays, plastic surgery are even for the youngest, for teenagers. So even teenagers are coming to undergo plastic surgery procedures. These procedures does not mean that they are coming for surgery. They may come for procedure. A procedure is different than an operation. Operation, when you take the patients to the operating room and operate on them, but a procedure when you do something quick in the clinic, in the office. For example, fillers for lips, for the faces. Lip fillers are very much in demand by the younger age groups. Botox for some individuals. Botox for other reasons other than the usual. What we normally use Botox for is for forehead, brow lift, wrinkles around the eyes, facials. No, it can also be used for other things like excessive sweating. This sweating that people complain of during the summertime, this massive amounts of wetness that comes out and even stains the clothes, which is quite embarrassing for the ladies and for the men. So this is one use for Botox. Another interesting use for the Botox, which some people are debating now whether it is very effective or not, is for weight reduction. How does Botox reduce weight? This is something that we need to look into, because scientists now are arguing whether it does work or it doesn't work by injecting the stomach with Botox. not from the skin, but internally by going through the mouth, using the endoscope and injecting Botox in the stomach to minimize the movement and makes the stomach lazy, and it will feel full and the person will stop eating. So these are extended applications of the current uses of Botox. Some of them, like the Botox for the stomach, may not be as scientific as people may think it is, but these are other uses. There are other uses for it. Third thing is the use of regenerative medicine, which is like plasma, like stem cells, and those stem cells are the cells that can regenerate into any other tissue. So these are also in the research phase. That research is now being applied to humans. Before it was only research in the lab. Now it's research on people, and the initial and the preliminary results are very encouraging, and probably we'll see more of it in the future. These are the main things that I can think about. There are some advances in the technical aspects which interest the surgeons more than anybody else, which is how to refine your techniques, how to improve your outcomes, how to get better results using different approaches, using different methods, threads, sutures, things like that. Well, the patient's expectations and the patient's requests sometimes exceed the capabilities of the surgeons. Sometimes the patients themselves are not aware of exactly what they want. Sometimes some of them have a distorted image of themselves. There is a condition called body dysmorphic disorder, whereby the patients may exaggerate a tiny thing or may imagine something that doesn't exist. Say somebody who is very thin and she thinks that she's really fat. This is one thing. So we have to differentiate those people from those who request the change, but the change in a dramatic way. They may need the change, but it doesn't have to be dramatic. You have to make the change that suits your ethnic background, your sex, your racial origin. You should not have a nose or a Caucasian nose on an Asian face. You should not have features of the eye that is different from your race. Beauty is to stay in harmony within your ethnicity and in your background. The effect of the social media, the effect of the new technology, the effect of the mobile cameras, the effect of the mobile phones have increased the demand for plastic surgery. Increased the demand especially for younger age groups. When you take a picture of yourself using a phone, that camera focuses on the most prominent part of your body, of your face, which is your nose. So most of the time when you take a picture, selfie with your phone, the organ that looks big is your nose. This increased the number of rhinoplasties, nose surgeries, amongst young people and amongst selfie takers. Selfie takers are not narcissistic. Sometimes they are very curious on how they look, but they give you a view that you never looked at. A view of your nose from the side, both sides, from the top, from the bottom, from this angle, from this angle. These are weird angles. Normally, nobody sees them. So, but the patients who are seeking perfectionists, they are looking to even perfect those views that nobody sees, which is really bad. This is number one that increased the number of plastic surgeries, the use of the selfie and the cameras. Number two is Instagram. Instagram is based on pictures, based on videos. People post, make an event and do their postings. They want to look good, and they want to look good with their in their selfie or in their pictures on Instagram. and also on Snapchat. People take pictures with their camera of themselves and publish it on Snapchat, and they want other people to comment. But when you take a picture of yourself, the distance between you and the camera is maybe limited to your arm length, which could be 70, could be 170 centimeters, could be less, could be more. But that distorts the actual image that people look at you through. So the use of the social media, especially using the pictures for expression, have increased the number of plastic surgeons or plastic surgery procedures amongst plastic surgeons. And my advice is, whenever you take a picture and want to post it, don't go to the plastic surgeon. Go to your camera and use all those filters to improve yourself. So this event has enlightened us, those who come from outside of Romania. Number one, of the culture and the nature, and how beautiful the place is, how beautiful the people are. Another thing is that seeing all those plastic surgeons, there are almost 400 plastic surgeons in Romania, and seeing all of those younger plastic surgeons eager and enthusiastic to learn, says something that this society and this profession and this country will flourish even more and better. The location of the conference was quite good. It gave us an opportunity for people to mingle with each other, because there is no distraction of the city. People are going somewhere else. They are staying in one place, which is nice and cozy. So it improved the relationship and improved the social interaction. Number two, it showed us how beautiful the countryside is, how the heritage and the culture is so rich in this region. We saw the palace, and the castles, Brandt Castle, and we also seen the scenery, the Danube, and we've seen the Parliament Palace, and the amazing architecture and the precision that was made, and that says that Romanians are true architects, are true engineers, true artists, and true plastic surgeons.